welfare continue to impact lives across the nation. It's indeed a privilege and honor for Basa Cancer Hospital and Research Institute for having the Honorable Minister of State for Health and Family Welfare and Chemicals and Fertilizers, Government of India, Srimati Anupriya Patel ji. अभी हम अनुरोध करते हैं आपका संदेश और मार्गदर्शन करें.
Honorable Chief Minister of Andhra Pradesh, Shri Chandrababu Naidu ji, former Vice President of India, Honorable Shri M. Venkaiah Naidu ji, Honorable Union Minister of State for Rural Development, my colleague in the Parliament, Shri Chandrasekhar Pemmasamy ji, Honorable Minister for Health, Medical and Family Welfare, Government of Telangana, Shri Damodar Raj Narasimha ji, Honorable Minister for Health and Family Welfare and Medical Education, the Government of Andhra Pradesh, Shri Satya Kumar Yadav ji, Trust Board Member, Shri Bharat Mathu Kumili ji, Honorable Member of Parliament, and the Chairman and Managing Trustee of the Basa Indo-American Cancer Hospital and Research Institute, the man who's brought us all here today, Shri Nandamuri Balakrishna ji. All the eminent guests who are present here today on this occasion, distinguished members of the medical fraternity, cancer survivors, our friends from the media, ladies and gentlemen, a very good evening and namaskar. I have great delight in joining you all today for the Silver Jubilee celebrations of the Basa Indo-American Cancer Hospital and Research Institute, an institution which stands as a shining example of compassionate care, dedicated service to humanity, and social commitment. On this momentous occasion, I convey my heartfelt greetings to the trustees, to the management, to all the dedicated team of doctors, the entire staff, the donors, and every other key stakeholder who's contributed immensely in this remarkable journey of nearly 2.5 decades. Congratulations to all of you. We all know that the sufferings of late Srimati Basa ji, who lost her life to cancer, became the inspiration for establishing this institute. And as I understand, the vision of late Dr. N.T. Rama Rao ji, the then Chief Minister of the state, was not merely to build a hospital, but to create a center of excellence which would ensure affordable and quality cancer care to every section of the society, particularly the underprivileged ones. And over the last 2.5 decades, I am happy to note that the institution has built an inspiring legacy where it combines advanced medical treatment and technologies with a strong commitment to both affordability as well as inclusivity. And the fact that a large number of the patients or the beneficiaries, they come from the economically weaker section of the society, it reflects the true spirit of service. I am particularly pleased to note that the institution has evolved into a comprehensive cancer care center with not just advanced treatment facilities and research capabilities, but also pediatric oncology services, palliative care, and most importantly, extensive community outreach programs. The contribution of the Institute towards cancer screening as well as building awareness, particularly in the rural and the underserved areas, demonstrates that healthcare institutions can play a transformative role beyond the hospital walls. Friends, cancer today has emerged as a significant public health challenge for our country. And in India, we have roughly around 15 lakh new cancer cases every year. While the advancements in the medical technologies and treatments have improved the rate of survival and the patient care outcomes, the burden of cancer continues to rise. And there are several factors behind it. The changes in the lifestyle that has come, the environmental factors, several factors which govern this continuous rising burden. And the real challenge that lies before us today is not just in providing affordable and quality treatment, but in preventing cancer and also in detecting cancer at an earlier stage. Because the entire medical fraternity understands that if you detect cancer early, it can improve the rates, the chances of survival. And Government of India has recognized cancer treatment as a key public health priority. We have a dedicated national program for the prevention and control of the non-communicable diseases, especially cancer, and comprehensive services are being provided, which includes everything right from prevention to screening to diagnosis, treatment, follow-up, and palliative care. All that is being strengthened across the length and breadth of the country today. And I'm also very proud to state here today that India has undertaken one of the world's largest population-based screening programs through a network of nearly 184,000 primary healthcare facilities, now called the Ayushman Arogya Mandir, across the length and breadth of the country, where every Indian citizen who's aged 30 years and above is being screened free of cost for 3 types of common cancer: oral cancer for both men and women, and breast and cervical cancer screening for women of this country. And I must commend the good work that our frontline healthcare workers are doing in building awareness and also ensuring timely reference and treatment of these patients. This population-based screening program that we have started through our Ayushman Arogya Mandir, it has today been able to screen more than 35 crore individuals for oral cancer, 16 crore women for breast cancer, and nearly 9 crore women for cervical cancer. And we would all understand that cancer, when detected timely, can help to a great extent in reducing not just the economical, but also the emotional burden on the families, especially those which are the less privileged sections of the society. And besides strengthening the screening and early detection services, Government of India has also scaled up the infrastructure across the country. So through our state cancer institutes, our tertiary cancer care institutes, our expanded oncology services which are now being provided in the new medical colleges that have come up. And we have really built many medical colleges in this government. There has been a huge scale up. Before 2014, we had around some 384 medical colleges. Today we have 820. So all these medical colleges today have these oncology services, and also the new All India Institute of Medical Sciences that have come up. We have 23 AIIMS now in this country. So everywhere, the infrastructure is being scaled up and these services are provided so that we bring cancer care closer to the communities, to the patients. And we also realize that financial protection becomes very important insofar as cancer care is concerned. The flagship initiative of Government of India, which you may have heard about or read about very often by our leaders, Pradhan Mantri Jan Arogya Yojana. This is an initiative under which eligible patients, and you would be happy to know that there are 62 crore individuals in this country, which includes the bottom 40% of the poor population, which includes the elderly citizens who are aged 70 years and above, our frontline healthcare workers, and also the gig workers. These 62 crores individuals, they all come under the purview of the Pradhan Mantri Jan Arogya Yojana, and under this scheme, all the eligible cancer patients are receiving support for treatment. Additionally, Government of India has launched initiatives like the Pradhan Mantri Jan Aushadhi Pariyojana and the Amrit Pharmacy stores, which are ensuring that the essential anti-cancer medications are now available to the general public at much lower rates as compared to the market prices. Prevention, ladies and gentlemen, remains our most powerful weapon in our fight against cancer. And here I would like to mention about the very recent initiative which was rolled out by none other than the Honorable Prime Minister of India, Shri Narendra Modi ji. And that is the HPV vaccination for our girls, for our daughters who are aged 14 years. And nationwide in all the government health facilities, we are doing the HPV vaccination to provide protection against the most deadly cancer, the second most common cancer which is causing death of women and girls in this country, cervical cancer. In all the government health facilities, this HPV vaccination is being undertaken. And we have a cohort of around 1 crore 20 lakh girls who are 14 years of age, and the program started, the vaccination started in the month of February, and by now, almost 44 lakh vaccinations have been achieved already, and the program is really picking up. In all the states, people are coming forward to ensure that their girls do get the free of cost vaccine, HPV vaccine, which is being provided by the Government of India. And we want to reduce the number of preventable cancers. Tobacco consumption, that is also something we have taken up on priority. We're building awareness and trying to discourage people to consume tobacco because it becomes one of the major reasons why people get exposed to the risk of cancer. So these are various steps Government of India has been taking to protect its people. However, the most important thing is that the future of cancer care in India is going to be shaped by innovation. And I'm proud to say that India is already embracing this opportunity. Artificial intelligence, digital pathologies, advanced molecular diagnostics, and several indigenous advanced medical technologies are today helping to improve screening, diagnosis, treatment, as well as follow-up. We have initiatives like Diamonds and several other research programs through which affordable, high-quality diagnostic services are being promoted, and at the same time, the vision of a self-reliant India, an Atmanirbhar Bharat in healthcare is also being advanced. And I believe that institutes like the Basavata Indo-American Cancer Hospital and Research Institution, they've got a big role to play in this mission. With what you're doing, whatever I have understood in the audio visuals and by listening to so many of the speakers before me, that the institute is really complementing the efforts of the government. insofar as screening, early detection, treatment, and follow-up, along with palliative care, is concerned. And you have your next phase of your journey wherein you have your plans of expansion. We also heard that a new institute is coming up in Amaravati. So I wish you all the best. And I hope that the coming years would see more and more contribution of this institute in providing comprehensive cancer care to the citizens of this country. So friends, let us work with a renewed determination to build an India where comprehensive cancer care is accessible for each and every patient, an India where every patient receives timely treatment, an India where preventable cancers are reduced not just through awareness building, but also by the promotion of adopting healthy lifestyles, and an India where innovation drives better patient care outcomes for our future generations. And with this, I once again convey my heartiest greetings to the Institute, the Basavata Indo-American Cancer Hospital and Research Institute, on completing its 25 glorious years of service to humanity. And I do hope that you will continue to illuminate countless lives with hope, healing, and compassion. Best of luck to everyone who's associated with the Institute, and thank you very much for having me here. It's been great knowing about the Institute. Thank you very much, all of you, for being such a patient audience. Jai Hind.
Thank you, Madam. Thank you very much. I request Chairman Garu to present a memento to Honorable Minister Anupriya Patel Garu.